Good morning and welcome to the annual public meeting and annual members meeting of Lincolnshire Partnership NHS Foundation Trust. My name's Kevin Lockyer and I'm the Trust Chair. We are, as we have done for the last few years, holding our annual public and members meetings online, and we've pre-recorded a significant amount of the content that you'll see this morning to make that process of an online meeting run, hopefully, fingers crossed, more smoothly. That doesn't mean, of course, that there isn't the opportunity to ask questions. There will be an opportunity at the end of the annual public meeting when you've heard presentations from me and from members of the executive team. There'll be the opportunity to ask questions. And if you have any, then pop them in the chat function and we will do our best to answer them when we get to that stage. The purpose of this morning's meetings is to reflect on the Trust's performance and to hear about the successes and challenges that we face. That we faced over the last year, and I will get into the substantive elements of that in a moment. I've got a bit of bureaucracy to dispose of first, which is to invite members of the board to approve the minutes of the last annual public meeting, which was held on the 28th of September last year and which have been circulated in advance. So I would be very grateful if colleagues, board members were able to indicate in chat whether or not they are content for me to sign those minutes to true record. It would appear that the answer to that is yes, so thank you very much. So we'll move on to the pre-recorded elements of this morning's meeting. I just want to offer some reflections on the past year. There's an awful lot I could talk about, but you'll be relieved to hear that I'm not going to talk about it all. But it is really difficult to pull out highlights for a meeting like this, but I've done my best. So it's another year where we've been affected by the COVID pandemic, not as much, but we've still had to work really hard to protect staff and patients from infection, and that's affected a lot of our services and everything that we've done. And we've also seen a significant increase in demand for our services, and some of that too has been driven by the COVID pandemic, but there are other factors at play too. But demand for our services has significantly increased. But within that context, notwithstanding all of that, it's been a year of significant development and significant improvements. So some highlights of last year. I've got to start with the completion of our new wards in Lincoln. I was massively proud to be involved in opening those. They are an absolute quantum leap in terms of the therapeutic environment and the care that we can offer to patients and service users, and the way in which we've engaged service users and experts by experience in delivering a design that is fit for the 21st century has just been, being involved in that at all has just been really awe-inspiring. So I'm really proud of that. I'm now, of course, looking forward to the £30 million investment that we've got in mental health services in Boston. We've now got planning permission for a new inpatient unit on the Norton Lee site in Boston, and I'm determined to be there on the first day of work commencing with my shovel to help. It's an absolute landmark for Boston and a landmark for us. So really looking forward to that work start, which I hope will be towards the end of this year or early next. I want to talk a bit about our community mental health transformation programme, which we're delivering as a real partnership across primary care, the voluntary and community sector, and we continue to make positive progress with that programme. We're expanding primary care. There's more funding for local community groups and programmes, including nightlight cafes. And I've been to the nightlight cafe in Lincoln, and they are, kind of transformational in terms of the support that they can provide to patients and service users. All of this is emblematic of an organisation that genuinely wants to offer no wrong door for our services. Talk a bit about our new strategy in a moment, but making sure that people have accessible services that they don't get lost in is absolutely critical, to our continued development as an organisation. Last year, I briefly mentioned the development of our mental health urgent assessment centre, and I'm really proud to be able to say that not only is it now permanently funded, but it's up, operating, and it's keeping people out of A&E that don't need to be in A&E. And as a result, we're helping to manage demand in A&E, but we're also putting people in a more appropriate environment than a busy, noisy accident and emergency department. We're taking referrals from the police, from the ambulance service, and community walk-ins, and it's seeing that service develop and be implemented from a standing start has been absolutely fantastic, and it's a really inspirational piece of work, which I'm really proud to be able to highlight. We all know that early mental health support for children and young people is particularly important at the moment. Going back to my comments a moment ago about the continued impacts of the COVID pandemic. And that's why we're continuing to expand our mental health support teams in schools across the county. We're working with our commissioners at Lincolnshire County Council to look at how we can truly transform the support available for young people and for their families. It's work that we're going to continue during the coming year, and there's a lot more that we still need to do. But it's been a highlight of the work that we've been doing this year. I'm really pleased that Lincolnshire is not only part of the newly refreshed Operation Courage, but we're the lead provider across 7 providers in the Midlands, providing an absolutely essential service, both service users, patients and their families and carers, providing specialist support across public, private and voluntary sector to this essential, this really important group of patients and service users. So really pleased that we're doing that. Finally, the last thing I want to mention is the work that we're doing around dementia. We know that we've got an ageing population in the county, and we know that assessment and support across that population is of critical importance. So we're looking at how we can take learning from the pandemic to expand the ways that we can help people access particularly digital services. So our newly launched digital memory assessment is proving to be very successful, and it's supporting faster access to assessment and therefore faster access to support, and helping patients and service users and their families live wherever they live, to access services more effectively. I mentioned the new wards at Lincoln. You might have noticed I'm really pleased with them. If you've not had a chance to go along and look at the new wards in Lincoln, here are some images that give you a really good impression of what they're like, and people that have seen the wards that they represent, that they replace, will know what a significant improvement that represents. And there are some images too of the proposed building at Boston, which will be just as good. I've got to touch on some changes at board level since last year. During the year, we've said goodbye to some directors. We've said goodbye to Jane Marshall, Director of Strategy, People and Partnerships. We've said goodbye to Anita Lewin, Director of Nursing and Quality, and we've said goodbye to 2 non-executive directors, Andy Spring and Sharon Robson. But we've also welcomed a number of directors. I'm really pleased to say we've welcomed a new medical director in Dr. Girish Kunigiri. Really pleased that we've said that we've welcomed a new people director in a newly created role in Amy Beaton. And I'm really glad that we've welcomed a new Director of Nursing and Quality in Sharon Harvey. We're currently recruiting for a vacant non-executive director position. And I should also say I'm really pleased to welcome Di Bailey into her new role as Deputy Chair. I want to say a few words about the Trust's new strategy. It's been 5 years since the Trust last published a strategy, and a lot's happened in that 5 years. We've had a pandemic that has significantly influenced all of our lives and the way that we deliver our services. But throughout all of that, we've stuck to an underlying vision, and we're taking that underlying vision into our new strategy. And that vision is to support people to live well in their communities. And I'm really pleased that we've got to a stage where we've now been able to publish a new strategy, still informed by that same vision, but which enables us to articulate how we want to deliver services to the population of Lincolnshire in the changed circumstances compared to 5 years ago. You know, as I've mentioned, we've done lots that I think we can be rightly proud of, but we know that there's still a significant journey for us to take, and our strategy tries to articulate the ambition that we've got for improving the quality, accessibility of our services and the experience of patients and service users. So I was really pleased that as a board we approved a new strategy. It's now available. It's been developed with, a really intensive piece of stakeholder work that's involved and engaged a wide range of people, from staff, patients, and of course the Council of Governors. And I'm really proud of it. Urge people to go and have a look at it and see how, as a trust, you know, we want to get better over the next 5 years. So I want to close this part of the meeting by taking the time to say thank you to our volunteers, including our Council of Governors, and those who've given their time freely to benefit our patients and carers. I'm really grateful for everything that you do. The board's really grateful for everything you do, and the trust as a whole is grateful for everything that you do. I want to say a particular thank you to Lisa and to Christine, both of whom have received long service awards as volunteers this year. Thank you, Lisa. Thank you, Christine.
Okay, we'll move on now to hear from the Chief Executive, Sarah.
Hello everyone, I'm Sarah Connery. I'm the Chief Executive of Lincolnshire Partnership NHS Foundation Trust, and I'm really delighted to have a few moments to talk about 22-23 and some of the Trust's achievements, and then take a moment to look to the future and what's coming up on our horizon. First of all, to talk about performance. From a performance perspective, we remain in segment 1 of the oversight framework, which is the best it can be. However, we are also part of the wider NHS Lincolnshire system as a whole, which has its challenges. And as a system, Lincolnshire is rated as segment 4, which means that it receives additional support to help us manage our collective finances. Demand on services has continued to rise, and we acknowledge that our waiting lists are higher than we would like it to be in some teams. We've worked with our commissioners to expand our capacity, and you've heard Kevin talk about some of this investment over the past year, and this continues forward with further expansion in our community resources, particularly in services for children and young people, and also our Lincolnshire NHS talking therapy services. As a result of this, we're seeing some real positive improvements in our service waiting times, for example, for children and young people. We're also seeing real positive impact from our Here For You access team, supporting young people and their families with advice and signposting, and ensuring that they're accessing the most appropriate service for their needs, whether this be Healthy Minds or more specialist CAMHS crisis service. We heard earlier how we're also working closely with commissioners on a whole review of children and young people support across the whole of Lincolnshire. This is really exciting to ensure that we're providing the very best service for what people need when they need it. This year, Steps to Change has also had a rebrand and is now known as NHS Lincolnshire Talking Therapies. Essentially, the team are continuing to have some challenges with some of their waiting times, particularly in some areas of the county or where people need certain types of treatment, such as cognitive behavioural therapy. We've been working really hard to recruit therapists to help tackle this. We continue to support people through a stepped approach to treatment, providing access to groups, online workshops and self-help support initially, with the opportunity to step up and access one-to-one therapy where further help is required. The community mental health transformation has been phenomenal, and it's having a real positive impact for people accessing support in their communities, with vital input from our third sector partners, community projects, and our integrated place-based teams are working with GP practices to embed early intervention through social prescribing and offering really seamless support when people are discharged from specialist services. We continue to see particular challenges with our early intervention in psychosis service, with more referrals being received and also particular challenge in recruitment in this area. We're paying particular attention to recruiting to help bolster that resource available. Our 24/7 helplines for both adults and children and young people continues to be a core part of our initial contact offer, and access to these services has significantly increased over the last year, with double the calls now being dealt with by mental health matters on our adult helpline. They signpost or provide opportunity to talk to someone when you're struggling to help avoid intervention from those crisis services. On the whole, inpatient care has continued to perform well in the mandate for no inappropriate out of area care. Despite us not being able to hit the zero target this year, this is mainly due to the temporary closure of some services, which I'll come on to shortly. The Mental Health Urgent Assessment Centre, working alongside the Psychiatric Clinical Decisions Unit, is having a really positive impact in helping to avoid hospital admission. Our bed managers do an amazing job in managing what beds we have locally and working with other agencies when that out of area care is required, to keep in touch and bring people back to county as soon as possible. Our biggest challenge, however, is recruitment and retention, and you'll hear more about what we're doing to tackle this challenge in our people section coming up soon. Throughout the year, we've been consulting on some changes to our services, so I'd just like to take a moment to give a picture of where we are on 3 of those developments. So we've consulted on changes to our mental health rehabilitation care services, and we've approved the permanent closure of Ashley House in Grantham, which has facilitated a full county-wide rollout of community rehabilitation model. And we've had great feedback from service users and carers and their families, and from staff as well, in terms of how effective that service is to care for people as close to home as possible. We've also further extended the closure of our Manthorpe Older Adults Ward in Grantham, which is allowing us to expand our pilot of the really fantastic dementia home treatment model for a further 12 months, also putting in some additional posts for more physical healthcare services in that service team as well. We did have to take a difficult decision last year in terms of making an emergency decision to close our psychiatric intensive care unit called the Hearts Home Centre in Lincoln, due to significant staffing pressures across our adult inpatient wards. We've been working really hard to make sure that we are recruiting to vacancies across adult inpatient services, and the plan is to reopen that ward in November 2023. We work hard as an organisation to provide the very best service for our patients, service users, carers and staff, and we're continually looking for ways that we can benchmark and learn from others on best practice. We're always seeking ways to hear the voice of experts by some of the ways in which we celebrate this and ensure we're meeting expectations is by applying for national accreditation schemes and awards. It was great to see that despite another really busy year, many of our services continue to maintain their service accreditations from the Royal College of Psychiatry. Our commitment to carers also continues to be resolute, and we were so pleased to have been re-accredited for the Lincolnshire Carers Quality Award and the Triangle of Care across a number of services. It was fantastic that our efforts were also recognised in national and local awards. A particular well done to our Lincolnshire's Children and Young People Complex Needs Service, who won the Midlands Regional Parliamentary Award for Mental Health. And service users and staff from the Francis Willis unit, our low secure unit, were successful at the Mental Health Safety Improvement Programme Learning Awards run by the East Midlands Patient Safety Collaborative for the great co-production work that goes on at the Francis Willis unit. We're pleased to also confirm our commitment to veterans and the armed forces with the Silver Award in the Armed Forces Covenant, and also to our LGBTQ+ staff and patients network with our Gold Employer Award from Stonewall. I'd now like to take a moment to talk about our partnership working across the Lincolnshire health and care system. Lincolnshire officially became an integrated care system from the 1st of July 2022. And although we've been working for a number of years as a system and trying to integrate and collaborate across all of our partners for a number of years now, we now have an integrated care board, which I formally have a seat on, representing mental health in the county. Here at LPFT, we continue to work closely with our local authority through our Section 75 contract, providing adult social care services in an integrated way with our mental health community teams. We're working closely with all of our partners through a dedicated mental health, dementia, learning disability and autism alliance on some really important targets. For example, physical healthcare checks for people with serious and enduring mental health, physical health checks for people with a learning disability, and improving those our performance as a system around reducing health inequalities. Through this board and other partnerships, LPFT have been investing to get traction on some really key issues such as suicide prevention, autism services, and something that we're really proud of as a system, the How Are You Lincolnshire Wellbeing website. However, we often hear from service users how they feel passed from pillar to post when trying to access support, being too poorly for some services and not poorly enough for others. So there's definitely more that we need to do to connect services up and ensure seamless transitions. We're trying to adopt a no wrong door approach with our alliance, where we bridge gaps in services and build pathways where transitions feel seamless to those needing our support. Now to take a moment to look ahead. Kevin spoke earlier about our refreshed trust strategy. We spoke earlier about how our trust is part of a much wider system, and we must ensure that we align with a wider strategic direction in the health and care system. Better Lives Lincolnshire is where all public sector organisations are working together to improve the health of our citizens, not just through the health services that we provide, but also looking at the social determinants of ill health, such as education, housing and employment. We can't do this alone. We're very much taking a wider lens in our strategy development, ensuring that we're aligned to our local partners and the work of the Health and Wellbeing Board and the Integrated Care Partnership. This does come with challenges, but we must stay focused on our role as a key anchor institution in the system, seeing our role as not just a secondary care provider, but as a key advocate, promoting mental wellbeing and healthy lives for those with a learning disability and autistic people. Ultimately, we are all here to improve the health of the populations we serve. I just want to end with saying it's been an absolute privilege to lead this organisation as Chief Executive over the past 12 months, and I'm so looking forward to continue to drive forward and implement our trust strategy with our system partners in the Lincolnshire health and care system. Thank you.
We'll move on now to Amy Beaton, Director of People.
Hello, I'm Amy Beaton and I am the Director of People here at Lincolnshire Partnership Foundation Trust. This is a newly appointed role on the board. I commenced in November 2022 and it recognises that workforce is a key priority and a risk for us, and I feel very privileged to occupy this role at the Trust. It's been a challenging but also positive year for our people agenda. We recognise the pressure that recent industrial action has had on our people and our ability to continue to deliver services. But even during such times, how we work together is something to be proud of. Before I provide a flavour of some of the things we've been working hard to achieve, I do want to reflect on how positively our people talk about our organisation in the National Staff Survey and through our engagement cycles. We've once again performed very well when we nationally benchmark our staff survey results, and whilst we saw a dip in our response rate and some other areas, we've continued to be above average against all the themes compared to other similar trusts. We particularly are pleased to hear that 73% of our people believe we take their health and well-being seriously. This is 10% higher than the national average, and as a result we've been asked to share our best practice around staff wellbeing regionally and nationally. We do recognise, however, there is much to do, such as addressing the vacancy position you heard Sarah talk about earlier, as well as tackling some of the disparity that some of our people with protected characteristics tell us they experience. A real concern being around bullying and harassment and violence and aggression experienced by our BMA colleagues, which we are wholeheartedly committed to remedying. We have a 5-year people plan with annual priorities to ensure we deliver agendas that will have a positive impact on our people. This is organised under the 4 pillars shown on the screen. This people plan takes an internal focus. We've listened to our people through surveys, feedback forums, our staff networks, and it also takes an external focus because we maximise our collaboration where it makes sense at a system or regional level, and we pull on best practice from other organisations and we use evidence-based resources that have been developed nationally. So what have we been doing? I'll summarise some of the key areas under each of the 4 pillars. So under recruiting pillar, we have secured investment into continuing our international recruitment efforts for at least the next 3 years. We have been absolutely delighted to welcome internationally educated nurses, medics, allied health professionals, social workers and healthcare support workers, and we are really grateful to those individuals for making the huge step in moving from their own country to support our organisation, and we will continue to do all we can to make sure that their experience is a positive one. We would also like to recognise the huge contribution our staff have made in supporting those individuals to not only settle in our organisation, but also in our community. We are also committed to growing our own workforce, and we again have invested for at least the next 3 years in apprenticeships, particularly in nursing as our highest vacancy staff group. And finally, hopefully you have seen pictures of some of our staff on buses, petrol pumps, advertising boards as part of our attraction strategy to recruit more from our communities and move away from our reliance on online NHS platforms only. Under the valuing pillar, as I said previously, we're really pleased that our people recognise the importance we place on their health and well-being, and we work hard to ensure our offers are person-centred and also can be accessed in a number of different ways, and we're really pleased that we've seen a reduction in our sickness absence. We've provided additional support to our staff networks to enable them to have the capacity to progress with pieces of work that they hear are important to our people. Each of us executive directors sponsor a network, and we are really grateful for the commitment of our staff to help us improve in key agendas. Under the developing pillar, this year we've worked hard to develop our compassionate leadership approach, and it's really well aligned to our values and behaviours as an organisation and the culture we always strive to have. We have a suite of leadership offers centred around compassion to ensure all our current leaders and all our aspiring leaders display this way of being with their people and with our patients. And finally, the retaining pillar. This year we launched all our new staff benefits through creative ways that would reach our staff. And flexible working is a real priority for us too, recognising that flexibility looks different from different people. So we're really offering a wide range of flexible options, and we're leading from the board on this agenda with our first part-time appointment in Sharon Harvey, our Director of Nursing and Quality. So hopefully that's given you a snapshot into all the hard work that we are doing around the workforce agenda. We are seeing real positive results from our interventions now, with sickness, turnover and vacancies reducing for us. But we are committed to continuous improvement, and we look forward to the year ahead around the ambitious agenda that we've set for ourselves.
And we're here now from Sharon Harvey, our Director of Nursing and Quality.
Hello, my name's Sharon Harvey and I'm the Director of Nursing and Quality here at Lincolnshire Partnership Foundation Trust. I want to start by saying a massive thank you to our staff, whether working directly with patients or not. They've all have such an important role in making sure that people receive high quality and compassionate care. And without them, we wouldn't have very much to tell you today. So I'm going to take a few moments to talk you through our quality highlights from the last year. And I started in post as the Executive Director for Nursing and Quality in April this year. We've not had a full inspection by the CQC of our services since 2020. This means that our service is remain rated good overall and outstanding for well led. However, that doesn't mean that we haven't been in regular contact with the CQC. The Trust continues to be subject to regular Mental Health Act reviews by the CQC to make sure that we remain fully compliant with our Mental Health Act duties. We also are in touch with CQC regularly around compliance and overall standards of care. In 2022-23, there were 5 visits conducted by the CQC around our inpatient wards for rehabilitation, low secure and dementia. We've continued to keep the focus on our absolute purpose, which is to ensure that service users and carers experience high quality and compassionate care. By high quality, we mean care is safe, that it's evidence-based and it promotes a positive experience to achieve outcomes, but ultimately to improve people's quality of life. To get this right, we know that partnership working is essential. We know that if we work in partnership with our service users, carers, staff, governors and other system partners and stakeholders, that we will improve patient safety. And we know from that we can make sure we achieve our purpose of people living well in their communities. We could not do this without our dedicated and skilled workforce, many of whom have worked tirelessly through the pandemic and in the recovery from the pandemic. I want to take this moment to express my gratitude to those teams, especially those who work directly with people and their families. As in previous years, each clinical division has a quality priority focused to their area of practice. You can see those on the slides behind me. I want to particularly draw your attention to the work the adult inpatient division have done in relation to introducing care as champions on the acute wards. We're already seeing a really positive impact from this and we're looking at continuing these roles. We've made them substantive within our division and we're looking at expanding them into our rehabilitation services. Across the Trust as a whole, it's a real priority for us to make sure that the carer voice is heard meaningfully in every area of our clinical delivery of care and how we design and how we review our services. We've been accredited again with the Triangle of Care, which we're really proud of as an organisation. It's really important that we meaningfully hear from people who have experienced our services so that we can do better, so that we can learn, and so where we're doing things well, we can keep doing that. Our specialist services division have worked really hard to make it easier for people to provide feedback on their services in an accessible way. And the Learning Disability Expert by Experience workers have done a brilliant piece of work around the Your Say Your Way project to make sure that we can accessibly hear from people with a lived experience that have a learning disability. All of our divisions have worked really hard on achieving their quality priorities, and you'll see many of them are continually developed into future years. So the slide behind me now talks you through our focus over this coming year and how that aligns to our quality strategy for 21 to 26. Reducing suicide in our community remains an absolute priority to us, and we're working hard with our system partners to continue on this work, learn more and to improve in this area. We want to make sure that people experience care in the least restrictive way. Part of this is so that we make sure people have the right support in their communities, and you'll have heard that at different points of today already. But also when people do need to come into hospital, we want to make sure they're there for as short a time as possible, get safe and effective care while they're with us, and then can go back to live good lives in their communities as soon as possible. So any restrictions that are placed on people as part of their care, whether in the community or in our inpatient services, has to be an absolute last resort. You'll see through the priorities for the year that we're striving to improve further and do more on how we receive feedback and how we meaningfully involve and hear from people and their families in everything we do. We're going to be reviewing all of our quality priorities over the coming year in light of the new strategy refresh. This slide here briefly looks to show you how we've gathered feedback on how people have been involved and participated in some of the work that we've done over the year. Thank you to everyone that's taken the time to give feedback, whether it's for areas of improvement, things that you've not been happy with, or things that we've done well. And thank you to people that have been involved in some of the development and design of our services and some of the reviews. We're looking forward to doing more of this over the coming year and to make it even easier for people to share their concerns and their feedback with us. So finally, thank you for listening, and I hope this demonstrates some of the work we've done so far and our ambition to further improve high quality, compassionate care that people experience in the year ahead.
And we'll hear now from our Director of Finance, Mark Platts.
Good morning, my name is Mark Platts. I'm the Director of Finance, Digital and Estates for the organisation, and I'm here today to talk through a bit of a summary of the financial accounts for the financial year 2022 to 2023. So, to summarise the year, the organisation has achieved its financial targets, and that's helped us to support the wider Lincolnshire Integrated Care System's financial position. So we've been working collaboratively with all the organisations in Lincolnshire to do the best we can for our patients. We've also delivered and now opened some significant capital investment across Lincoln, and this has managed to eradicate all dormitory wards in the Lincoln area. So we are moving on to Boston, which I'll come on to in a bit, but the Lincoln scheme was a real significant one and was actually the biggest capital investment we've had in mental health services in well over a decade. So really, really key development for us there. However, this is in the backdrop of continued staffing challenges, and we are now seeing, on the back of COVID recovery and the issues and challenges over in Ukraine and Russia, that financial cost pressures are hitting the organisation, as it is with every one of us in our day-to-day lives. So we're really finding the need that we're going to have to start to look at how we can operate more efficiently and financially effective in the future. So we do need to focus on that one. To summarise the key financial headlines for the organisation, we did actually report an £8 million surplus on a system reporting basis. However, due to a non-recurrent one-off financial hit on the back of building the Ellis and Castle wards in Lincoln, we actually reported a net deficit of just under £400,000. And this is driven by the building actually costing us more than the market value that it's now worth. This isn't out of the ordinary, and this is something that actually most organisations find when they do develop big significant capital builds. So from that viewpoint, it's a deficit, but it's a manageable position, and it makes perfect sense from a financial viewpoint. In terms of our non-current asset base, as you can see from the slide, this has now increased from £72 million last year to £99 million in this financial year, and that is pretty much driven by the Ellis and Castle ward development. In terms of capital expenditure, we've broadly spent the same as last year, and that's because it's taken us a 12-month period over the 2 financial years to build those 2 wards. So we didn't just build it in this financial year, we built it over the previous 2 financial years as well. So that's why you can see that the capital expenditure broadly similar, even though we've had the significant increase in this year's net current asset base. Cash balances, we're maintaining at broadly around £40 million, and that's a level that we've maintained for a couple of years now. So that gives us some opportunity to invest that in the future when we're able to, and working with NHS England. Moving on into next year, so financial year 2023 to 2024, I just want to pick up on a couple of key headlines really for us to focus on moving forward. So building on the success of the Lincoln scheme, we're going to start to look at commencing our Boston eradication of dormitories. And once complete, that will have eradicated all dormitory-based mental health accommodation in Lincolnshire, which is a really good achievement for the organisation. We're also going to continue on our innovative recruitment drive to enhance our workforce stability and hopefully start to reduce the need for temporary, more expensive agency and bank staffing. So it's important that we have a sustainable, stable workforce for us to deliver the best service we can for our patients. Also, we're going to focus on getting the best use of our financial resources across the organisation. So we're going to build on some of the great innovative work that's happening across the services and corporate divisions and look at how we can be more cost effective and more efficient moving forward. Working as an integrated care system, we're going to work with our system partners to make sure that we can deliver system-wide financial stability. This is going to include us looking at maybe different ways of working together and how we can improve kind of services across all organisations and not necessarily focus on the barriers of particular trusts or teams. So it's important we work as a system moving forward on that one. Across the system, there are a number of significant major capital investments that are happening. So we've talked about our Boston scheme. There's also schemes over at the United Lincolnshire Hospitals Trust and other trusts across the system. So it's important that we manage the delivery of those effectively so that we can really make the most of the capital investment that we're getting as a system at the minute and deliver the best buildings that we can provide care in as possible. It's also important that we continue to work on the collaboration that we're doing with a number of our system partners to help us develop the best services we can across the broad range of providers in Lincolnshire. An important one for me personally as well from a financial viewpoint is we look at the system-wide delivery of investment standards. And this needs to be done across all service areas, so not just those with mental health, but also include those with dementia, learning disabilities and autistic people to make sure that we can get the best possible care out of every pound that we invest moving forward as well. So collaboration is going to be really important with that one, working with our integrated care board and wider partners. So I'll leave it there as a summary for the financial year, and I'm happy to take any questions. So thank you very much.
Okay, thank you. So that concludes our presentations this morning on the trust position and our last year. There's the opportunity now for questions. We haven't had any submitted in advance, and I don't see anyone, any in chat yet, but I'm happy to wait a few minutes to see if any materialise. I don't see any questions. All of the slides that have been spoken to this morning will be available later on the Trust website if people want to go back and have another look at them. With that then, we'll finish the public part, or the annual public meeting part of this morning's session and move on to the annual members meeting. And I need to, with that in mind, introduce Debbie Abrams, the lead governor.
Good morning, everybody. I'm Debbie Abrams. I'm the Public Governor for the Trust, and in May this year, I was privileged to be re-elected as lead governor by my fellow governors. I've served as a Public Governor for 5 years now, having been elected in 2018. During this time, I've visited services within the Trust and represented the public at various meetings and events. And it's my job today to tell you about the work of the governors. So who are the governors? The governors are all members of the Trust and all volunteer their time to be governors. The service user, carer, public and staff governors are all elected from the membership of the Trust. We also have some governors appointed by organisations who work most closely with the Trust to deliver care to the people with mental health and or learning disability needs. Governors have two main duties. One is to represent the membership and the wider public, and the other is to hold the board of directors to account for the performance of the Trust via our non-executive directors. The duties of the governors during the last year were, first of all, to ensure that we carried out those two duties I've just mentioned. Governors attend a Council of Governors meeting where the duties form the most important part of the agenda. As well as doing this, governors give their views to the Trust to ensure that the needs of the public are included in the Trust's strategic plans. We're given the opportunity to read and comment on the Trust's annual reports and accounts so that we can understand where the Trust is doing well and challenge any areas of underperformance. Quality is an important part of what the Trust does, and as governors, we agree the Trust priorities and review the annual quality report. As a Council of Governors, it's also our responsibility to award the contract for the external auditors. During the year, governors were involved in the selection process for 2 non-executive directors, and it's the Council of Governors' responsibility to appoint to these positions. We also appointed a new deputy chair of the Trust. As the only foundation trust within Lincolnshire Integrated Care System, it's vital that in our role as governors, we do our very best to represent the views of the people of Lincolnshire. A moment ago, I mentioned that one of the Council of Governors' responsibility is to represent its members. Anyone can be a member of the Trust, and joining is easy. People just need to complete a simple application form. For those of you who are members, thank you. And for those that aren't, please sign up today by contacting Samantha Swindle, who is our Governor and Membership Officer. It's easy to do, and details about how to do it can be found on the Trust website. On the 31st of March 2023, there were over 9,000 members, and we continue to recruit new members. Please do ask your family and friends to join as members of the Trust. Towards the end of 2022, of the year, it ended actually March 23, we started to return to some kind of normality following the COVID-19 pandemic. And this meant that we were able to start meeting our members again. However, we continue to engage in both written and electronic material, as well as face-to-face now. There have been increasing opportunities for governors to engage with members at public events and a range of groups and committees that are run by the Trust and other organisations. And I'm really pleased that we now have the opportunity to visit services, which provides the opportunity to meet service users in a variety of settings. This year, we are engaging with members by holding today's public meeting, albeit by virtual means. We have held our council meetings in public and published all of our meetings, agendas, papers and minutes. These meetings are now held using technology, which allows members and the public to observe in real time these meetings. They're also recorded, which means you can look at them on the website at any time you wish to. We produce a printed Better Together magazine twice a year, and between times we produce an electronic version of this magazine. Both versions are available via the website. As governors, we want to hear about innovations and ideas that members of the Trust and public can give us to help us to contribute to the Trust's future plans and to make services better in a co-produced approach of inclusion. Doing things together with your input is always better. The feedback you give enables us as governors to influence key decision makers, both within the Trust and in the Lincolnshire integrated care system. Sometimes, where issues relate to individuals, we can direct concerns to the appropriate services and produce immediate improvements. You have heard from the directors about the Trust's quality and financial performance, and as a Council of Governors, we regularly receive reports through a variety of routes, and we hold the board to account, as I mentioned earlier, by the non-executive directors, who provide assurance reports to every Council of Governors meeting. Governors have the opportunity to directly contribute to the Trust's agreed quality targets and are particularly keen to review the Trust's progress against the Care Quality Commission's outcomes. I would like to take this opportunity to thank you on behalf of myself and all the governors for joining us today and supporting the continued work of the Trust. I'm now going to hand over to Jenna Davis, Director of Corporate Governance, who will provide you with the facts and figures around our membership and the requirement of the Constitution. Thank you.
Good morning, everyone. I'm Jenna Davis and I'm the Director of Corporate Governance at LPFT, and I'm here today to talk to you about our Constitution and our membership. As a foundation trust, we are required to have a Constitution. Our Constitution is a set of fundamental principles and processes by which our trust is governed. In the year, we have undertaken our annual review of our Constitution, which has brought us into line with statutory and legislative changes. It's enabled us to reintroduce the Lincolnshire Police as a specified partnership organisation. In order for us to ensure local accountability and ensure we hear a wide range of views, we have 4 membership constituencies: public, service user and carer, staff and stakeholder. Each of the membership constituencies is represented by governors. Some governors are elected and some governors are nominated. Our elected governors represent our public, service user and carer and staff constituencies, and our nominated governors represent our local stakeholders, and these are partner organisations such as our local university, councils and local authorities, and various voluntary sector organisations. As a foundation trust, members play an important role in having a say in how our trust develops and how our services are delivered. Our membership numbers must remain representative of the communities that we serve. In 2023, we had 9,200 members. We need to demonstrate that our members' interests and our public interests are represented, and therefore need to show that all of our local communities are represented within our membership. Our information demonstrate that women are overly represented, but otherwise our data indicates the profile of our membership is broadly in line with Lincolnshire's population. In 2022-23, we ran elections for 4 service user and carer governor roles. 2 of seats were filled, however these subsequently became vacant again, and we will be holding new elections in the near future. Thank you for attending today's meeting and listening to my presentation. Does anyone have any questions?
Before we take questions from members or from the public, I need to hand over to Karen Scott, Head of Corporate Governance, with some governor election results. Karen.
Thank you, Kevin. Good morning, everybody. I'm delighted to be able to announce, hot off the press, the results of our recent governor elections, which were carried out during the summer. Nominations closed on the 24th of July and voting closed as recently as 5 o'clock on Friday last week, hence hot off the press. So the elections that were held were for the staff governor constituencies, and we also held some by-elections in the public and service user constituencies. So for staff governor elections, we had 2 constituencies which were contested, and the results were as follows. Adult inpatient services, Helen Smith has been re-elected. Kelly Cow is newly elected. In adult community services, Andy Leaston has been re-elected, and Dan Fleshbourne is newly elected. There were also some uncontested seats, and those were in the following staff governor constituencies. For specialist services, Lisa Norris has been re-elected, and 1 vacancy remains within the service. In corporate services, Laura Suffield has been re-elected. And in older adult and frailty services, Jackie Tyson has been re-elected, and 1 vacancy remains within the service. I'll move on now to the public by-elections. There were 2 seats that were elected. The public seat for City of Lincoln, which was contested, and I'm pleased to announce that Alexandra Chambers was successfully elected. For the seat of Public Governor South Holland, it was an uncontested election, and Jonathan Sibley has been elected. In the service user by-election, it was an uncontested election, and Alice Barton is elected, and there are 3 vacancies remaining within that constituency. So those are the results of the elections. I just want to say before I finish, on behalf of the Board of Directors and Council of Governors, I want to extend thanks to Christine Cooper, who will have served 9 years in her staff governor role within adult community services, the maximum time that a governor can serve within the trust. I know that was mentioned by Kevin in his presentation, but just want to emphasise that. And thank you to all governors who give up their time voluntarily in the role that they carry out on behalf of the trust. Thank you.
Thank you, Karen. That brings us to a conclusion for the annual members meeting. Again, if there are any questions, then please pop them into the function on Teams. I haven't seen any at the moment. So all it remains for me to do is to thank all of my colleagues, both directors and Debbie as lead governor, for contributing this morning, and thank you very much to members of the public, members of the trust and members of the public that have been able to join us this morning. I hope that you've found what we've had to say useful, illuminating, helpful. As I think I've mentioned, all of the slides that we've used will be available on the trust website. So in the absence of any questions, all it remains for me to do is to thank everybody this morning and to bring these proceedings to a conclusion. Thank you very much, everyone.